Hi, we are from the University of Buffalo, Region 1, and today we are going to be talking about the battle of the opiate crisis. As many of you may know, the opiate epidemic has been an alarming topic that has been surfacing throughout the web. With an increased amount of people using opiates and illicit drugs, there's a correlation with an increased number of overdoses compared to the early 2000s. Just let alone in 2016, New York State has reported over 14,695 naloxone kits being administered, and this is only what has been reported. Which is why we need to stand up today and be one of the first to take action in our community by hopefully hosting our very first annual Opioid Crisis Awareness Fair.
Hi, I'm Jenny.
And I'm Anil.
And I'm Chang.
I'm Andy.
We're from the University at Buffalo SNPhA chapter, and this is our prescription for service submission. To address the opioid epidemic crisis, we would like to host an opioid health fair. The health fair will be held at our local Walmart, which is accessible to a lot of our underserved population. We plan to advertise at local hospitals, specifically targeting emergency rooms where overdose patients are frequently treated. Our target demographic is patients who are using opioids or friends and family affected by the epidemic, but the goal of the project is the inclusion of the entire community. For our health fair, we plan to have 5 different stations. Station 1 is going to be Naloxone Training. Here we plan to invite speakers from the Erie County Department of Health, which has experience providing opioid overdose and naloxone training to our pharmacy students and to the local community. With the money from this grant, we plan to purchase about 20 naloxone trainer kits, which we can use to help educate our local patients on how to use naloxone in the case of an overdose. Lastly, we plan to talk to patients about how exactly they can access naloxone from local pharmacies. By ensuring that more of the population has access, we aim to decrease the number of deaths from overdose. The goal of this station is the empowerment of our local community by giving them the tools to help fight the opioid epidemic.
The second station will focus on education. The goal of this fair is to help the community by providing education. At this station, we will be educating the public about the detrimental effects of opioid abuse, such as addiction, overdose, and withdrawal. We would also talk about certain things that the public and patients can do to combat the opioid epidemic and manage their own pain.
Station 3 is the drug take-back station. At this station, there will be law enforcement officers educating the public about National Prescription Drug Take-Back Day and providing information about next event day. We will also talk about how you can drop off unused or expired medication year-round at the sheriff's department. Lastly, we will have local officers inform about the process for disposal and provide a list of local sites.
Station 4 will be the Opioid Counseling station. At this station, pharmacy students will be providing counseling services to new and existing opioid users. The students will establish realistic goals of pain therapy with the patients and the proper usage of opiates. We would also emphasize alternative pain management techniques and other options when appropriate.
Station 5 is addiction and dependence management. We would invite our professors here at UB who specialize in opioid addiction. They work with many patients routinely, helping them use Suboxone and other medications to manage their addiction and counseling them with the end goal of being drug-free. With their assistance, we can help patients who already struggle with addiction. We will use the pieces of these 5 stations to break the cycle of addiction.
In terms of sustainability, the trainer kits that will be purchased are a one-time purchase but can be used for years to come. And there are also 2 pharmacy schools in the area which will provide the students to help continue the vision we have in helping the underserved community in Buffalo, New York. We thank you for your time, and we look forward to
connecting the pieces with you.